This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2020. Surgeons concerned about a possible infection after performing revision shoulder arthroplasty must decide the postoperative antibiotic therapy without knowledge of intraoperative specimen culture results, as these are often not finalized until weeks after the surgical procedure. Thus, surgeons rely on their preoperative and intraoperative observations to determine their index of suspicion for infections when selecting the appropriate antibiotic therapy. Researchers investigated factors associated with the initiation, modification, and adverse events of two postoperative antibiotic protocols in 175 patients undergoing revision shoulder arthroplasties. Patients with a high index of suspicion for infections were administered the intravenous IV antibiotic protocol, while the oral antibiotic protocol was used for patients with a lower index of suspicion. The antibiotics were later either withdrawn or modified on the basis of culture results. Results showed that the surgeon's anticipation of culture results based on preoperative and intraoperative observations was accurate in 75% of the cases, and modification of antibiotic therapy was required in the remaining cases. Interestingly, male patients were more commonly converted from oral to IV antibiotics because of positive culture results. Other factors significantly associated with initiation of IV antibiotics included a history of infection, intraoperative humeral loosening, and membrane formation. Adverse events of antibiotics were observed in 19% of the patients, and the rate of complications was lower in those receiving oral antibiotics and a shorter antibiotic course. The findings indicate that certain preoperative and intraoperative characteristics, such as male sex, history of infection, and membrane formation, can guide surgeons' selection of postoperative antibiotic regimen, allowing them to correctly anticipate the culture results in a majority of cases.